The small town of Teni and its surrounding villages, situated alongside the Western Ghats, are filled with farmers and people involved in agricultural business. Over 60% of them are illiterate. Many do not have access to proper health care. The closest city, Madurai, is 75 kilometers to the east. 1 decade ago, Teni became significant to a vast number of people. In 1985, Aravind Eye Hospital was inaugurated here. The Teni Aravind Hospital began catering to the needs of over 1 million people living in the Periyakulam, Ondipati, and Uthamapalayam taluks of the Madurai district. Besides these primary service areas, it also began serving a secondary area covering the Idukki and Kottayam districts of Kerala, with a population of another 1 million people. Since the Teni Aravind Hospital services meet the needs of rural people, making the people aware of eye care delivery and bringing them to the base hospital for treatment is of primary importance. The hospital concentrates on preventive, promotive, and rehabilitation eye care services. To implement these three components of eye care delivery, it adopts outreach programs including screening camps, village volunteer programs, and school eye health education programs.
Any situation being in rural area, we can easily, this hospital is reaching a lot of rural people location wise. Apart from that, we are here, you can see the optimum utilization of human resources and optimum utilization of other resources also, material also, money also. And this being a small hospital, 100 bedded, it can be easily copied and replicated in each district.
With these goals at the forefront of its vision, Teni Aravind developed its working structure: physical structure, organizational structure, outreach programs, financial stability. Physical structure. This two-story building houses an outpatient clinic, operating theater, inpatient stay facility, and the free section. The outpatient clinic facility includes a patient's waiting hall, a preliminary vision testing area, doctors' cabins, 2 refraction testing chambers, and a laboratory. There is also a reception room, optical shop, drugstore, septic operation theater, and office. The inpatient stay facility includes 6 general or C-class wards on the ground floor and 4 A-class rooms, 8 B-class rooms, and 1 C-class ward on the first floor. There is also a nurse's duty room on each floor. The operating theater includes 3 operating tables with a sub-sterilization, preparation, store, dress changing, and main sterilization area. The free section has an outpatient's clinic facility and 3 general ward facilities for poor patients. Along with these facilities, there is a canteen and a garden which provides vegetables for the poor patient's food. Organizational structure. The Teni Aravind Hospital is headed by a senior resident medical officer with 2 other medical personnel, 11 paramedical staff, 10 administrative staff, 13 housekeeping and maintenance staff. Village volunteers, field workers, project coordinators, and supervisors help in research projects.
We manage this large volume workload with 3 doctors. Though I am the senior doctor, I take the maximum load because of my experience, and I have got 2 more doctors who help me. But more than anything else, I think the paramedics who help us a lot. in doing the large volume of work. The sterilization sister, she brings the patient in after anesthesia, puts the patient on the table. Then the scrub nurse takes over. She prepares the patient, drapes the patient and prepares for me. Then I do my job and then I move on to, I need not wait for the other things to happen. I need not wait because I know after the surgery is over, someone else will come, put the bandage, take the patient out. So these works are very, very compartmentalized and very specific, with a specific person for a specific job. Our paramedics are well trained in particular jobs, refraction. On top of that, depending on their aptitude, now we teach them something else also when they come here. For example, refraction is giving anesthesia, or a outpatient sister helping out in the theater as running sister, or sterilization nurse. So it helps in the sense I can rotate my staff to a place where the maximum intensity of work going on here, and we schedule our work in that way. Like in the morning we have theater, in the afternoon, means in the morning itself, from 10 onwards up to 1 o'clock, so we have work in the outpatient department. In the afternoon we shift our attention onto the inpatient care and septic theaters. Apart from that also we have got some more approaches like standardized procedures. A refractionist or a OP sister knows a patient who is coming for presbyopic correction, what are the minimum basic investigations to be done. So even if I am not there or the doctor is not there in the OP, they will get the minimum investigation done. When the patient comes to me for his presbyopic correction, I need to see him maybe for half a minute to 1 minute. By that time I can prescribe him the glasses, I can see his anterior segment, I can see his fundus. And this is the approach we use, standard procedures in all areas. That's how we save a lot of time.
Outreach programs. The main reason for Aravind success is its outreach programs. Aravind has developed strong community outreach activities. The Aravind team conducts screening eye camps. It goes to interior villages, screens the community, selects the patients for surgery, and brings them to the hospital for treatment free of charge. If the patients need intraocular lens implant surgery, lenses are provided to them at an affordable cost of 500 rupees. This team also trains local village volunteers to raise the village people's awareness of eye care and to bring potential patients to the hospital. The Aravind team is also implementing a comprehensive eye care project for community awareness through eye health education in order to promote and assist the prevention of blindness. This project will include school eye screening and treatment of children suffering from refractive errors, strabismus, and vitamin A deficiency. Another objective of this project will be to promote curative services by conducting screening eye camps and establishing a strong community-based referral system. This will also provide effective and appropriate rehabilitation services such as social, educational, vocational, and economic services to the incurably blind. Finance.
Unless an institution or hospital grows, not structure-wise, but knowledge-wise, advanced equipment-wise, it cannot grow. One has to keep pace with the advancing knowledge. You cannot depend on donations and think of expanding. For any expansion programs, for any research programs, for any ongoing medical education program where we want to participate, it's very important that we have our own financial stability.
Tenny Aravind Hospital is able to generate sufficient revenue to meet operating expenses and 60% of free services. In the year 1995, the total annual income of this hospital was over 2.5 million rupees, and expenditure was over 1 million rupees. 59% of its annual income was surplus for the hospital. The major income of the Teni Aravind Eye Hospital was operating charges. Staff salary and their benefits, IOLs, and electricity bills were major expenses. The Aravind principle of treating a large volume of patients at an affordable cost without any compromise on quality provides a model for other eye hospitals in the country. Since Teni Aravind's inception, it has treated about 390,000 patients and performed about 24,000 surgeries. The innovation of intraocular lenses, or IOLs, changed the way of life for many people from rural areas because implant surgery became affordable to them. With the resulting increased vision, rural people feel more comfortable at their work, and the economical burden of the aged people diminishes. As it gains recognition, the demand for IOL implant surgeries consistently increases. Teni Aravind has proved itself efficient and successful in recent years. Its 100-bed facility functions with only 3 ophthalmologists. It is financially viable and is in fact thriving economically and expanding its services. The ratio between service availability and the rural population in need is highly imbalanced. The establishment of hospitals like Teni Aravind Eye Hospital in rural areas is the real service necessary to eradicate unnecessary blindness.